Hypertension, a case study by Misty Bird. Danny is a 39-year-old male of Caribbean family origin with no significant past medical history. He smokes 25 cigarettes a day and consumes 20 beers per week, times 18 years. He works shift work and considers his diet unhealthy. His BP on initial exam is 147/89. Danny was seeking treatment for a sprained ankle. His blood pressure was noted to be 147/89 on initial exam. He was then asked to record his blood pressure for 1 week and return to the office. Upon his return, it was noted that his blood pressure ran in the 140s/80s. Risk factors for hypertension include race, age, using tobacco, drinking too much alcohol, and stress. According to the American Heart Association, there are largely no signs and symptoms of hypertension. Hypertension is called a silent killer. Tests include ECG, tests for the presence of protein in urine and hematuria. Blood tests include glucose, electrolytes, creatinine, estimated GFR, total, and HDL cholesterol. Other tests include optic fundi examination, calculation of BMI, auscultation for carotid, abdominal, and femoral brevis, examination of heart and lungs, palpation of abdomen, assessment of lower extremity pulses and edema, and neurologic examination. Hypertension is caused by an increase in cardiac output or total peripheral resistance, or both. Hypertension is consistent elevation of systemic arterial blood pressure. It is the most common primary diagnosis in the U.S. There is primary hypertension and secondary hypertension. Black adults have the highest rates of hypertension in the world at 44%. Hypertension is higher among heavy drinkers of alcohol, more than 3 drinks per day, than abstainers. Moderate drinkers, 2 to 4 drinks per week, have the lowest average blood pressures and cardiovascular mortality. Primary hypertension is a result of complicated interaction between genetics and the environment that increase vascular tone or increased peripheral resistance and blood volume, causing sustained increase in blood pressure. Secondary hypertension is caused by an underlying disease process that raises peripheral vascular resistance or cardiac output. This is a graphic of the pathophysiology. Treatment options include eliminating modifiable risk factors, lifestyle modifications, dietary recommendations, exercise, reduced stress, and thiazide diuretics. Other options include beta blockers, ACE inhibitors, decreased alcohol consumption, and to stop smoking. Danny was diagnosed with primary hypertension stage 1. He was prescribed a thiazide diuretic, lifestyle modifications, smoking cessation support was provided, and he decreased his alcohol consumption by half. He continues to work on his diet and exercise. Exercise promotes endurance and relaxation. Physical training increases stroke volume, which lowers heart rate and hence systolic blood pressure. Relaxation is expected to reduce levels of circulating catecholamines, which reduces vascular tone and blood pressure. Pharmacologic treatment reduces risk of end organ damage and prevents major disease such as MI or stroke. Thiazide diuretics and beta blockers have been shown to be safe and effective. Individuals with heart failure or chronic kidney disease, post-MI, or have had recurrent stroke should begin with ACE inhibitor, ARB, or aldosterone antagonist.